So it's another very beautiful day today, and if you're new to my channel, I'm Brianna, a music therapy intern, and I'm currently at a pediatric hospital here in San Francisco, and I'm 3 out of 6 months done, or almost at the halfway mark of my internship, and it's crazy because it literally flew by so quickly. And this video, I just wanted it to be about the instruments that I use every day. And since it's a hospital, there are obviously many beds and many patients that we see in a day. And I am working in the hematology, oncology, and blood and marrow transplant unit, as well as some patients that are in the rehab program. And so those are the units that I primarily work on, and these are the instruments that I bring around with me, and depending on the patient I'll switch it out and stuff, but these are my top 10-ish instruments that I use. And so let's get started. So this first one is obviously my guitar, and also all these instruments are wiped every time I enter and exit a patient's room, and yeah, just because it's sanitary. And we just want it to be as clean as possible, because many of the patients are immunocompromised, and especially in the oncology and blood and marrow transplant unit. And so the guitar, all the songs, most of my songs are played. Sometimes I do a cappella if there's hand motions and stuff, but guitar, hello song, goodbye song, all my children's songs. And since I'm still kind of new at this, I'm a lot better now, but I have a lot of songs memorized for children's songs. So I have a list of the songs that I use the most, and if I blank out all of a sudden, because I keep it going, I go Wheels on the Bus, Mr. Sun, Baby Beluga, Itsy Bitsy, just the classics. And I just put this little note on my guitar. And so yeah, guitar, I love guitars, I'm a guitarist, so yes, very important for a pediatric hospital music therapist. So the next one that I'm going to talk about is, let's look in my baggie. I carry this bag around, and I bring the maracas. These are just really good for kids that are younger to grip and hold them, and there's 2 of them. Sometimes I give it to parents to use and play together, but very handy. And so a sibling of these maracas is let me look in the bag, the egg shakers. And so these egg shakers are also very fun to hold. They say UCSF, music therapy, on here. And we have a bunch of these, so sometimes we leave them for the patients, and if they want to play around with them, they can in their free time. So these are the 2 shakers that I always have in my bag, the 2 types. This next instrument has 2 names, but I call it it's more commonly known as the xylophone. So this is a xylophone, and the mallets are attached, and it's also called the glockenspiel, but xylophone. And kids love these, and it's if I play in the key of C, all these notes will sound great. And yeah, it's so useful. I saw my supervisor use this, and I don't know how many sessions, honestly almost every session I've used this, because kids love this. And I've recently also tried using this rainbow colored one, and I can take off the notes and to match the other one that I have, so that also if they play in the key of C, then it'll sound great. And there's also a mallet for this one, but it's just pretty and rainbow. So those are the 2 that I switch off on. Like I said, they're really good for flow states, where if I keep continuous music going and then my patient is just playing, and they just I have so much fun using this. And the patients that we use this with, literally from ages 2 and younger, to we have an 18-year-old patient that loved improvising on this. And yeah, that's the main intervention that we use, is improvising with the glockenspiel / xylophone. So this next one is a little bit loud and obnoxious if you play it too much, but it's called the ocean drum. And this is a kid version of the ocean drum. The regular version is a lot bigger, and also it's made out of a different material. This is plastic, so it's easy to wipe also. And this one has like little fishes in it, and there's beads inside, and so it kind of mimics the sound of an ocean. And kids love this, and there's so many good uses to it. They love like the beads in it, but like it's also, if you like play it too much, it's just really annoying. And whenever I clean it around the hospital, I'm just trying to be really careful. But this is, kids love it, and I bring it everywhere with me. And typically I feel like in a session I'll bring this, the shakers, and the xylophone, and my guitar. So I'll wipe all those things and bring it in. And yeah, the bigger one, like I said, has like more fabric, and like the beads are like not plastic, so again, it sounds a little bit better than this one. But again, it's perfect for kids. They love this, and yeah, it's great. So my next two instruments are very similar, or I count them as one, but these are like rain sticks. There are bigger ones, but this is basically the ocean drum in a stick form. They're a little less obnoxious, a little more calming. This is like a smaller one, and my younger kids love this, and then yeah, a lot of my older kids also love this, or older as in like school age kids. But rain stick, small rain shaker. So up next we got the bongo, and self-explanatory, very fun. Lots of things you could do with it, and also you can use the mallets to hit it, and good for improv, good for beat keeping. Yeah, like I said, self-explanatory. Very good instrument to have in my bag. And I've worked with like rehab patients, and you know, if you're trying to work on like, you know, hitting with both hands, or like crossing midline, and like so many different goals, yeah, bongos are just a solid instrument. So this next one is a ukulele, and just this past week or last week I taught 2 patients how to play the ukulele. And actually, as a guitarist, I don't play the ukulele that much, so I was kind of learning with them, but the chords are really simple, and like it's just good for a lot of ages. And yeah, my patient was 6-year-old and also a 14-year-old patient, so again, the age range is wide, and they really enjoy it, and it's pretty simple to learn, and it's like a small guitar, and like I said, it sounds happy, and it's very fun to play and easy to learn. And this one's really pretty, it has like a nice design on it. But yeah, and sometimes we get to let the patients keep the ukulele, so they really like that. And learning a new instrument really helps with like coping and, you know, building a sense of identity. So learning instruments is great, especially in a setting that, you know, is kind of hard for them. Learning a new instrument can be a way to cope and try new things while they're here. So this next one is a very, very cool instrument. It is the tiny keyboard. This is a Yamaha one, and it actually sounds pretty good. And I actually just saw my patient that I've been teaching piano on, and she's been learning with one hand, and she left for a few weeks and just came back, so and she showed me that she still remembers the songs that I taught her previous admission, so it was really cool. And I love jamming out with patients with this little tiny keyboard. And I also brought this with I used this while I was doing like vocal warm-ups with a rehab patient, a speech where I was co-treating with a speech therapist. So it comes very handy for like vocal warm-ups, and you know, like different things you would need a tiny piano for. Yeah, this is just very tiny and cool. So this last instrument / item that I bring with me is this iPad. And nowadays there's so many cool apps that we can use. And there's one that I use that you can make cool beats. And one of my patients, we were writing a song, and she wanted to put a beat behind it because it's about a dance party, and so she loved doing that. And it's just so easy to use, and like yeah, so it's just really convenient too as well. And I also use this to look up lyrics, and like if I don't know a song, then sometimes we'll play it on YouTube and just listen to together, like recorded music. And so yeah, iPad's very essential. It goes with me to almost every session. If it's for a younger patient and I know the songs that I'm doing, or it's just like, yeah, a shorter session, then I won't bring it. But if it's for like teens, or like somewhere where I need to, in case I need to look up a song, then I'll bring the iPad. And again, there's a lot of cool instruments and cool stuff that you can do with an iPad nowadays. So those 10 items are not the only instruments that Pediatric hospital music therapists use or music therapists use. My co-interns, they use different ones as me. When you're working in the NICU, obviously it might be different. When you're working with more rehab patients, you might use other instruments like boom whackers, the bigger xylophones. Like, there's just so many good instruments that can help our patients meet their goals. And yeah, so there's so many instruments, but these are just the ones that I carry or I've been using these past 3 months and for my time here. And so I hope you enjoyed this video and that it was informative, and thanks so much for watching. Don't forget to live a life you can't put into words.